Welcome to the TOEFL listening section. In this part, you will hear one or more conversations in an academic or campus context, such as a discussion between a student and a professor, or between two students. You may take notes while listening. Listen to part of a conversation. You will hear it only once, so listen carefully. After the conversation, you will answer questions about what you heard. Some questions will ask you about main ideas and details. Others will ask about implied meaning, speaker attitude, or how ideas relate to one another. Use both what is stated and what is implied to answer.
Good afternoon, Dr. Rivera. Thanks for meeting with me during office hours. I want to finalize the literature review section of my project on athletic performance at altitude, and I have a few questions.
Good afternoon, Sam. Sure. Tell me where you are stuck, and we can clarify the physiological mechanisms and practical applications.
First, I want to be precise about time courses. My draft says that hematological adaptations like increases in hemoglobin mass require at least 2 to 4 weeks at moderate altitude. Is that accurate?
Yes, that is a reasonable summary. At elevations around 2,000 meters, persistent hypoxia stimulates erythropoietin production, which drives red cell production. Typical studies report measurable increases in hemoglobin mass and hematocrit after 2 to 4 weeks of continuous exposure.
Okay. I wrote that as a range to be conservative. But acutely VO2 max drops at altitude because of lower partial pressure of oxygen. Should I explain that contrast more clearly?
Definitely. Acute exposure reduces maximal oxygen uptake because arterial oxygen content falls. That lowers maximal aerobic power. However, with acclimatization, some systemic changes occur, and sea level performance can improve after return if the program is well designed.
So that brings me to training strategies. The literature emphasizes live high train low protocols. Can you help me explain why that model works?
Live high, train low balances the hematological stimulus of living at higher elevations with the ability to maintain high-intensity workouts at lower altitude. Live high, train low allows athletes to get hematological benefits without sacrificing high-intensity workouts.
That sentence might need unpacking for readers who are not familiar with training logistics. Could you give an example of how a team implements it in practice?
Certainly. A cycling team might base itself at 2,500 meters for sleeping and general activities, while doing interval sessions at 1,000 to 1,500 meters, or using hypoxic rooms to simulate nightly altitude. Some athletes use sleeping tents to mimic high altitude while training near sea level.
I have a passage on physiological mechanisms beyond red cell mass. What are the other adaptations worth highlighting?
Include ventilatory acclimatization, which increases resting ventilation and improves oxygen uptake. Also mention peripheral adaptations such as increased capillary density in muscle, shifts in mitochondrial efficiency, and enzymatic changes that can enhance oxidative metabolism. Some studies show altered lactate kinetics and a higher anaerobic threshold at sea level after altitude exposure.
Are those peripheral changes as fast as hematological ones?
No. Many morphological changes like capillary growth and mitochondrial biogenesis are slower. They may require several weeks to months and depend on training stimulus during exposure. That is another reason to preserve training intensity through strategies like live, high, train low.
What about the common claim that high-altitude training increases running economy? Is that a direct effect of altitude or a byproduct of other adaptations?
Improved running economy can result from several factors. Reduced body mass from altitude-induced weight loss can help. Neuromuscular changes and improved oxygen delivery and utilization can also play a role, but the evidence is mixed and often depends on the individual athlete and program design.
I plan to include case studies. Would it be appropriate to cite elite East African runners who train in E10 at about 2,400 meters?
Yes, that is a classic example. Many Kenyan distance runners living in E10 and similar highland regions benefit from chronic hypoxia from daily living and childhood exposure. Use that as an example of natural, long-term adaptation rather than short-term training camps.
Are there risks I should emphasize for coaches and athletes considering altitude camps?
Absolutely. Mention acute mountain sickness, which can impair training in the first days, iron deficiency because of increased erythropoiesis, and the potential for increased blood viscosity if hematocrit rises too much. Also note the risk of maladaptive responses, like prolonged fatigue or loss of training quality, if athletes cannot maintain intensity.
So monitoring is critical. What metrics should teams track during altitude training?
They should monitor hemoglobin mass or hematocrit, iron indices like ferritin, arterial oxygen saturation at rest and during exercise, subjective wellness, sleep quality, and training power or pace to ensure intensity. Regular blood tests and a protocol for iron supplementation if needed are standard practice.
I remember reading about simulated altitude training. How does that compare to natural altitude exposure?
Simulated hypoxia can replicate reduced oxygen partial pressure using tents or hypoxic chambers. It can be effective for nightly exposure or intermittent hypoxic training. However, outcomes vary and simulated methods may not perfectly reproduce other environmental factors like barometric pressure or temperature.
Should I discuss ethical and anti-doping concerns related to erythropoietin and altitude training?
Yes, note that natural altitude-induced erythropoietin is different from exogenous erythropoietin administration, but monitoring hematological values is important for both performance and anti-doping transparency. Emphasize that altitude training is a legal and accepted method when done transparently.
Finally, for my recommendations section, what practical timeline should I suggest for a competitive athlete planning a major race at sea level?
Recommend a block of 2 to 4 weeks at moderate altitude for hematological gains if the athlete can maintain training quality. Alternatively, consider live high, train low for 2 to 3 weeks. Allow for a taper and at least a week returning to near sea level to optimize race day performance. But remember, individual responses vary, so trial runs are best.
That helps a lot. I will revise the review to include these mechanisms: the live high train low example, monitoring guidelines, and the case study of ITIN. Thank you.
You are welcome. Send me the revised draft and we will look at the references together.
Listen again to part of the conversation, then answer the question.
Live high, train low allows athletes to get hematological benefits without sacrificing high-intensity workouts.
This concludes the conversation portion. For more TOEFL practice tests and study materials, visit Spinta.org.